The question, it's not phrased in a question. Inflammation and the acute injury process, common outdated convention of Rice. Look, if you have an ankle the size of a watermelon, the first thing I'm going to tell you is to put ice on it. This is like this really wild, convoluted social media sociology where people just love to be told by something or someone that they think is an authority that it's okay to do the wrong thing. Is there some type of reason to say that ice does something that can slow or retard healing? Yes, there is. However, you are also going to slow or retard healing from this significant swelling and inability to move the joint. And you have to go back a couple steps here, where one of the primary messengers that brought this out, not in the clinical research, but on social media, was a company that marketed a stim machine that would say use the stim machine instead of using ice. And nobody seemed to identify that this was not even ethical to be taking this message as good thought. Rest, ice, compression, these are all good things in the initial stages. Ice probably should not be used any more than 2 or 3 days if we are being effective at moving the joint. If you're starting to move the joint and you are properly safe to load, that is the next piece. That will become increasingly difficult, if not impossible, if your ankle is the size of a watermelon. So using ice or using other devices that are going to combine compression and ice, these are all very, very, very useful things. And not to be completely avoided. Now, that's a different scenario than my knee is sore after training, I'm going to put ice on it. Probably not. If that's the only thing that you can use that can give you some type of relief or benefit, then go ahead. But I don't think that's a premier choice. That's a completely different scenario than if you have this acute swelling. Getting swelling down, once you're there, once the fluid is there, and we need to remove the things that aren't helping the healing process, ice is not your enemy. And I think in the bigger picture, we should be very, very keen to evaluate where these messages are coming from and what is the motive. I'd like you to use ice. I'd like you to use rest. I'd like you to use compression. I'd like you to use stim machines that create a motor response that elicit descending inhibitory control that can control pain as well as move swelling. I think they left that part out of their video. And I'd like you to use everything possible that can have the correct arrow towards the correct result in adaptation. To eliminate something, especially in favor of buying something else, is a pretty dastardly thing to do, when in fact all of these things are useful, including ice, in the right situations.